I'll take this out for us. Okay, you ambulated, you tolerated oral liquid, that's great.
You're my man. If I ever need anything else, I'm coming to you.
Hi, we're here today. I'd like to welcome Dr. Steve Kiffel to the practice.
Thank you very much.
It's a pleasure to have you here. This is a board-certified medical anesthesiologist, which is a rare addition to a dental practice. But both Dr. Kiffel and myself believe that we should do things slightly differently in dentistry. So we're very excited to have you here. A real pleasure to add your level of skill to our practice. So if you'd like to say a couple words, we'd appreciate it.
First of all, thank you for having me. I really enjoyed working with your team. You created a very good, competent, enthusiastic team, and it was a pleasure to do our first case together in helping a patient who was turned away from other dental providers, even skilled dental providers, skilled in anesthesia and dentistry, because they felt they couldn't manage her peculiar issues such as morbid obesity and anxiety.
Yeah.
And you know, what we were able to provide her with was safe anesthesia in a monitored setting, and giving her exactly what she needs to have this done safely, and keeping her very controlled and comfortable throughout the procedure. And it worked out well.
Absolutely. It's an interesting thing because the Board of Dentistry, you know, my board, allows us as dentists to do IV sedation with sometimes as little as like a 7-day course. You know, the nice addition for a person like yourself is that that's all you do. That's what you do. If you don't mind telling us a little bit about your history and
Sure.
how you came to this position.
Sure. I attended Columbia University School of Dental and Oral Surgery in New York City, graduating in 1986, and I didn't maintain that interest in dentistry that I started with. However, I completed my degree, and subsequent to that training, I did a 1 year of dental anesthesia training at Mount Sinai Medical Center in New York City. Subsequent to that training, they said to me, you can stay on forever, or go back and get a medical degree and then get a full-fledged, you know, anesthesia certificate as a physician, or find something in dentistry. Well, I proceeded to SUNY Downstate Medical Center, finished my medical training there, and then returned to Mount Sinai Medical Center and did formal residency training in general anesthesia. And although I had a concentration in neuroanesthesia, I ultimately found myself years later interested in the ambulatory setting, and now currently I'm providing anesthesia in multiple ambulatory surgery centers.
Not just for dentists, but for
the full range of surgical
plastic
procedures,
surgeons,
from plastic surgeons, general surgeons, urologic surgeons, ophthalmologists, gastroenterologists, while maintaining hospital privileges. And I do go to a hospital on a regular basis to do the more involved cases.
That's great. That's great. It's nice because your dental training, even though it was, you know, so long ago, it's probably what allowed you to realize that what we ask our patients to go through is pretty tough stuff sometimes. When we're talking about major reconstructive dentistry or someone who's fearful, you know, it's really nice to have that sedation. You know, dentistry is sometimes can be tough, especially as it gets more involved.
Yes, I would agree. Certainly my dental background, and I did practice dentistry for 3 years after my training, allows me to appreciate not only what the patient needs, but also what the dental practitioner needs in order to achieve what he or she needs to achieve.
I think most patients would appreciate having a level of an anesthesiologist come in and do the anesthetic. You know, as you know better than I, you know, your job is a full-time job, as is the dental job is a full-time job. So you really need, I think, that division of workload.
Right. What we offer the patient here is someone who's expert on the dental side and someone who's independently expert and dedicated to the anesthesia side. So we're monitoring the patient, making sure everything's proceeding safely, giving the patient the necessary anesthetic medications, while the dental provider, like a surgeon in a hospital, has nothing to worry about except the surgical procedure.
Right. And it was interesting what Amy just said to you in the room too. When she was done, she said, "This is my guy. Whatever I need, he goes with me." So it really wasn't so much about the dental treatment. It was you. She bonded with you, and you were her connection.
Well, she was terrified of the procedure, and she was, like I said, turned away from other, specialist oral surgeons. What we accomplished for her was we alleviated her fear and developed a confidence level that she'll come back.
Right.
And that's what we want.
Yeah, absolutely. I mean, she's been suffering with chronic infections of those wisdom teeth. I think she did actually go to 2 different oral surgeons, both of which said, "We can't treat you in a dental setting. We have to send you to the hospital."
Right, because they view her anesthetic needs as all or none. All meaning full-blown general anesthesia or nothing. What we do is we provide finesse anesthesia. We give her as little as she needs to as much as she needs, but working our way up.
Yeah.
And maintaining her airway intact. Her airway reflexes are intact. If anything were to fall down, she'll catch it, she'll cough.
Right.
And keeping her intact throughout the procedure, although comfortable and yet sedated, and we're monitoring her vital signs for safety throughout.
Yeah.
And if she's able to complain that she needs more, we give her more.
Yeah, you were very responsive with that.
Very responsive to her needs. We keep on giving her more. But the goal is safety and comfort, but in a finesse fashion.
Yeah.
Some of the other providers who are comfortable and competent in anesthesia, to them it's either all or none.
Yeah.
They were afraid to put her under general anesthesia because of her weight.
Absolutely.
And you don't.
She didn't need it.
As you could see, she didn't need it.
Yeah,
and at the end of the game, she realized that she didn't need it either.
Yeah, she said this was a lot easier than I thought.
Mm-hmm.
When is the lower going to be done? We said she's done. She's like, oh wow, she was.
Yeah.
It was really an incredible experience, and I'm happy she was so nice to give us a testimonial too. That was really kind of her.
Yes, it was very nice.
Yeah, so it was a real positive experience, and that's just some of the examples of things that we're going to be able to accomplish. So that's why it's so great and such an honor to have you here at the practice. It really is.
Thank you. It's an honor to work with a practice that has matured and evolved to this level of class.
Thank you.